Double eyelid, possible enlargement, and defined lower eyelids question. Attached is a photo of my eyes and then a photo of the ideal eyes I want. Not only do I want double eyelids, I really like the defined lower eyelids that this actor has. What are the possibilities that I can come close to having eyes like that person? And what procedures am I looking at?
Thank you for your question. You have submitted some photos of what you feel are ideal eyes and one close-up photo of your own eyes. And you're asking that you want to have double eyelid surgery and you want to have a well-defined lower eyelid like the photo of the famous actor you submitted. Well, being a practicing cosmetic oculofacial plastic surgeon for 20 years, in Manhattan and Long Island, we have plenty of people who come to us with lots and lots of pictures of people from magazines and all kinds of things that where they have an idealized version, and many times they have a certain general resemblance with the celebrity that they want to look more like. But I would say to you that it is really not possible to look that close to someone else because their eye appearance is not just a function of the soft tissue, or let's say the skin and the muscle and the fat, but also about the bone structure. So a very important thing to understand is when you are looking to get us an improved appearance, think about it more in the context of what looks right with you or for you and is a little bit more realistic. I think that trying to look like someone else is just a real setup for disappointment. Now, that being said, I would say that for your overall desired look, where when I look at your photo alone without the celebrity photo associated, I think you can be a good candidate for a double eyelid surgery procedure. So as you're doing your research, and also something to also mention is that when you think of the lower eyelid as being defined, you'll be surprised to see that when people have their upper eyelids done, the whole eye area kind of opens up. And when it opens up so nicely, it's almost like you did the upper and lower eyelids in a lot of people, and when people actually see them, they don't even know that they had their upper eyelids done. Their just face looks brighter. This is a common impact when you create a double fold. The eyes just look more open, the person looks more awake, and you know, there are all these subtle unconscious signals that happen when the eyelids are very full. Some people are interpreted as being either angry or tired. So the double eyelid fold is a very, very popular procedure, and when you do your research, you'll see that there's a choice between doing an incisional procedure or a non-incisional procedure. In my practice, I basically look at making that choice based on a couple of things. First, if there is extra skin. If there's extra skin, there's no question that an incisional procedure will be necessary. If there's extra fat, or if there is fat that is getting in the way of a well-defined crease, then an incisional procedure is necessary. Now, a lot of our patients who come to us, very often male, thin males, relatively young, will actually not have that much fat and that much extra skin. And when I just roll up their skin a little bit with the Q-tip, I can see that they would probably be fine with just an infolding of the skin with no removal of the skin. In those patients, we do what's called a non-incisional procedure. Now, technically, a non-incisional procedure is still surgery. But what we're doing is, instead of making an incision and removing skin, what we're doing is we're making little openings, like a needle opening, in various points of the upper eyelid, and then we're passing a stitch in a way that engages the skin and then the underlying muscle, so that when the eyes are open, the skin folds in. It's a very gratifying procedure, and it works very well in selected patients. Now, is it possible for it to come apart and the eyelid crease to become not developed, even though it looks good? Yeah, it is possible. But at least understanding what your options are is very important before you make a decision about which way to go. So, I think that at this point you should start consulting some cosmetic surgeons and meet with people who have a lot of experience with Asian eyelid surgery and learn a little bit about your options. I think for your face and your character, it's something I believe in strongly. Everybody has a unique character to their face, and we don't want to try to look like somebody else, but look the best we can for ourselves. I think that you will do well with doing as little as is needed to give you the most benefit. I just, that's my personal style. I tend to be conservative, and I think that getting the double eyelid procedure will probably open up your eyes very nicely. And that's based on, of course, your concern and desire and commitment to already deciding to do the double eyelid procedure. It's just a matter of choosing which type of procedure and who should do it for you. So again, I think you have to now hopefully think about this in the context of the realities of facial bone structure of celebrities and people who you want to look like, and at yourself, and be sure that when you do this procedure, there's a zone or range of things, of results that you will find to be satisfactory. So I wish you the best of luck. I hope that was helpful. Thank you for your question.